Mainstreaming the public space in the spatial perspective of health. General descriptions in Indonesia. The COVID-19 pandemic has affected the productions and reproduction of public spaces. Major cities in Indonesia have experienced an economic downturn. The pros and cons of PSBB and PPKM implementations, both in the DKI Jakarta and Surabaya areas, have finally become critical issues and dilemmas. This is due to the complexity and problems of public spaces that have not been designed with the pandemic factor in mind. For these two big cities, there is no easy choice to rebuild public spaces that can simultaneously harmonize health and economic aspects. Both aspects play an important role in functioning the public sphere. Designing an ideal new public space in the new normal situations is the one that manifests the spirit of the city with its physical form and social structure. In producing post-COVID-19 public space, it should be understood as a flexible space and is an asset. Because public space is the main feature of a resilient city, in which the part of a resilient city relates to its ability to be transformed in line with the goal of addressing public health emergencies. The current public health emergency has demonstrated the value of flexible space. Public spaces, such as the field, have been converted into emergency field hospitals. This has been done by the Surabaya city government and the DKI Jakarta government. Jakarta Wisma Atlet, Athlete's House, for instance, has been converted into an emergency hospital for the COVID-19 patients, as well as the Genital Hospital in Indrapura, Surabaya. Thus it shows changes through value and imaginations, representation and public monetary practice on those public spaces. Moreover, it can already propel us towards modular and decentralized designs that allow for the public space's flexibility. This strongly supports the need to plot and create effective public spaces to pivot towards a healthy city. Incorporating health criteria in the design of public spaces is a novelty. Communities that exist in the present and future still require public space for work and recreation. For these reasons, the health perspective becomes a reference that can be used by planners and designers to conceptualize, design and build public spaces. These ideas need to be mainstreamed, including physical form of public spaces in accordance with the new normal order.